Welcome back. My next guest is Dr. Tharun Karthikeyan, who's better known to most of us as Dr. K. He's an orthopedic surgeon and the board chair at the Lexington Clinic. Welcome.
Thank you, Dr. Foxx.
Well, one of the reasons we asked you to come in tonight is to talk about, a long word here, I kind of get an Orthopedic and Neuroscience Center. And that's something a little different. It's one of the first in the country, or at least new.
Yeah, we're really excited about it. It's a brand new state-of-the-art facility that encompasses multiple specialties related to musculoskeletal care. That would include orthopedics, neurosurgery, neurology, interventional pain management, physical therapy, physical medicine and rehabilitation, all under one roof in a way that can really integrate the care for our patients that has not existed before.
Now, you mentioned all those under one roof, and you mentioned integrated care. Explain what that means and why all these people in one place.
Yeah, for example, let's consider low back pain, which is extremely common in patients that you and I take care of. Well, it can be very difficult for a patient or even a referring physician to understand where that pain is coming from. Is it coming from spinal stenosis? Is it coming from hip arthritis? What kind of treatment options are most appropriate for that patient? And with our new center, we can have the patient evaluated by orthopedics, neurosurgery, interventional pain management, physiatry, sometimes all on the same day.
Do imaging there also?
Imaging will be right across the street, but on the same campus, yes.
So you can, well, give me an example then of a patient you might see and what kind of specialists they might see in that process.
Sure, let's take an example of hip pain, for example. Many times if someone is referred to me by, let's say you, Dr. Foxx, for hip pain, that could include hip arthritis, it could include spinal stenosis, it could be a muscular strain. And so if that patient saw me, we would start with x-rays, which we can get right there in our facility. Depending on that, we may send that patient for an MRI, perhaps of their lumbar spine, because the x-rays of their hip were unrevealing. From that image, we could potentially discuss treatment options with either a neurosurgeon or an interventional pain specialist or physical therapy.
Now, you just mentioned 3 specialists there. And if you didn't have them all in one center, that would mean, in addition to your visit, 3 other appointments that they would have to do.
Absolutely. The current model of care generally would mean 1 appointment with me to evaluate your hip. Once we decide that it's probably not your hip, another appointment for an MRI of your lumbar spine, for example. Once we get those results, then a referral potentially to a neurosurgeon who may decide surgery is not the answer for you, and then referral to an interventional pain specialist for injections. And if those didn't work, sometimes another appointment for a physical therapist, which can be costly in terms of time and certainly in terms of discomfort for the patient.
And under one center, you can get that done a lot quicker, a lot more convenient.
Absolutely. And this type of model just simply does not exist in our region. We're very proud to be the first, and perhaps the first in the state as well.
Now, when you say first, you just recently opened, correct?
Yeah, we've been open for less than a month. We had our official ribbon cutting this past weekend, and we're very excited, but we've been seeing patients for almost 3.5 weeks now.
All right. Well, that's good information, and that's a really good help to patients. So I want to move from that just a minute. We don't have that much time left, but you are an orthopedic specialist. You do a lot of hips and knee replacements. Joint replacement in general, why?
Well, joint replacement is a good option for patients that have a diagnosis of hip or knee arthritis, have tried and failed non-surgical treatments like anti-inflammatory medicines, injections, physical therapy, and continue to have pain that affects their ability to function and what we call participate in activities of daily living.
So it makes them more mobile, more back to normal with assuming they're a candidate for a joint.
Yeah, in its simplest terms, I think that joint replacement aims to reduce pain and improve function for our patients.
But there's some people that are not a candidate.
Joint replacement is a major operation, and so not everyone is a candidate for joint replacement.
Your general health has to be okay to undergo the surgery itself.
It does, and we want to make sure that patients are as healthy as possible before undergoing joint replacement. In general, health conditions alone do not categorically disqualify you, but we may need to work on improving certain risk factors, for example, overweight, smoking, diabetes.
Well, that's great information. We appreciate the care you give the patients, and thanks for coming in to tell us about the Lexington Clinic's new Orthopedic and Neuroscience Center. We'll be right back.